October is Breast Cancer Awareness Month. According to the American Cancer Society, breast cancer is the most common cancer in women in the United States, outside of skin cancer. It accounts for 30% of all new female cancers each year. According to the CDC, nearly 13,000 new cases of breast cancer were reported across West Virginia and Ohio in 2023. Every Wednesday, we have been bringing you an in-depth look at the fight against breast cancer. Our Shyla Florence joins us live in the studio for this week's episode. Shyla.
Average woman has a 13% risk of developing breast cancer in their life. That is 1 in 8 women. First, we looked at the different types of breast cancer. Last week, we looked at how doctors will test and diagnose breast cancer. This week, we're looking into the different treatment options available.
The earlier you find the cancer, typically the less aggressive the treatment you need.
According to the National Breast Cancer Foundation, there are 5 different treatment options for breast cancer. However, nurse practitioner Joe Hendershot and Dr. Sabir Hirzan both say that the treatment is very dependent on the patient.
It's very individualized treatment. It's depend on your age, if you're premenopausal or postmenopausal, in your receptor status, in your stage, in your HER2 receptor status. So every patient need individualized treatment.
Dr. Jeff Reichman with WVU Medicine Camden Clark says a majority of the time surgery is the first step in treatment.
In general, just breast cancer treatment in general, surgery is the cornerstone of care. Most everyone walking down the street is a candidate for a breast cancer surgery because they're not very high-risk surgeries, generally speaking. So it's rare to have patients where if there's a lump in the breast that they're not able to just take that out. There are rare circumstances that that's the case, but the vast majority of folks are able to undergo kind of rather simple procedures, depending on, the extent and how big things are to begin with.
There are 2 types of surgery, a lumpectomy or a mastectomy. A lumpectomy removes the cancer and only a small portion of the surrounding tissue. A mastectomy removes the entire breast.
All the breast cancer needs some sort of surgery, either lumpectomy or mastectomy. A good number of them need radiation treatment. If they have lumpectomy, they need radiation treatment for sure. Some patient advanced stage who has mastectomy, even after mastectomy, they need radiation treatment. A good number of patients, I will say around 70% of the patient need hormonal treatment. Means the tablet to block estrogen for 5 years. Okay. Then patients who are HER2 positive or triple negative, most of those patients need chemotherapy and some sort of targeted treatment.
Dr. Hirzan says that most patients will need some sort of systemic treatment, which means treating the cancer through the bloodstream. This could be chemotherapy, immunotherapy, biotherapy, or hormone treatment. Some patients will also need some form of radiation treatment. Dr. Reichman says that radiation is not nearly as hard on the patient as it used to be.
Back in the day, our treatments after surgery would usually be between 6 and 8 weeks. For select folks, we can finish in 5 days. A lot of times it can be a pretty easy treatment to get through. However, there's some times where we kind of have to meet fire with fire, so to speak. For more aggressive cases, then we kind of do put people through tough courses of radiation.
Technology for breast cancer treatment has improved a lot over the past 10 years. Doctors with WVU Medicine Camden Clark say that they like the less is more approach when choosing the best treatment options for each patient.
So think of the cell phone technology over the past 10 years and the advances made in that. The same could be said for medical technology and radiation.
Don't run away from the treatment, because the treatments and options are many, and that can make a big difference in your life.
For WTAP News, I'm Shyla Florence. This is Home. There are several treatment options available for breast cancer. You can find a more in-depth meeting into each option on our website at WTAP.com. Next week, We will look into the signs and symptoms of breast cancer and who is considered high risk. Phyllis, back to you.